Good afternoon. Welcome to Facebook Live here from CGH Medical Center. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. Thanks for joining me this afternoon. Today is going to be field trip day. Everybody likes field trips, right, when you're a kid? So we're going to do a field trip in our new oncology space. Before we do that, though, I'm going to do a few items. So first of all, I want to talk about COVID and where we're at with that. So here's that's July 22nd, our numbers, and that's July 29th here in Whiteside County. You can still see the numbers are showing high community level. And those of you who are watching probably know enough friends and family that are getting COVID here and there that you know that. There's definitely still that circulated here in the community. So, and then I think Matt has some other stuff that I think is so this is just kind of the cases, and then, which is good, because if you look back in like January with the Omicron, the number of cases, daily cases, was much higher than it is now. I'm looking. So yeah, that's good. And then what else do you have, Matt? Yeah, so the middle one and the middle one is the daily hospital beds used. You can see it's ticking up some from where it was at. Like Omicron, the original Omicron kind of went down and was in pretty good shape, like end of March, April. And you can see it's kind of trending up there. But the ICU beds at least have not trended up, which is really good because for different reasons, these particular newer variants that we're seeing, we're seeing an uptick in people that are hospitalized, not as high as it's been in the past. And also the number of people that are getting really, really sick is not as high as it's been in the past either. So that's good. Just wanted to mention a study I saw this week that I thought was helpful just to kind of share with you. So this was in JAMA, which is Journal of American Medical Association, one of the higher profile, reputable journals here in our country. And they did a study for patients in long-term care facilities and those who had received the fourth dose of vaccine, basically versus those who hadn't. And if you've gotten those particular long-term care residents, and by the way, if you're in a long-term care facility, your immune system is typically not as good because you're older. The older you get, your immune system doesn't do quite as well. So even those folks whose immune systems weren't quite as good, and by the way, this is data with Omicron included, not the variants, but at least Omicron itself, which even Omicron was a variant of what we had been seeing. For those individuals, the likelihood of getting infected was 34% less, which isn't great, but it's better than nothing. But in particular, hospitalizations, 64% less chance, ICU admissions, 67% less chance, death, 72% reduction. So what does it tell me to tell you? Get fully vaccinated, and it makes your likelihood of getting really, really sick become much less. So that's my take home from that study. What we're seeing across the United States, in the last 2 weeks, the number of cases are down about 6%. This has been an interesting particular surge with this BA4, BA5 variant, and then it just kind of seems like it's gone up and just is kind of plateaued and not gone down, but not been quite as high. I'm hopeful that 2-week trend of down 6% is a sign that we are for this particular surge, are trending in the right direction. We'll know more when I talk with you in a couple of weeks, but I'm hopeful on that. Well, in terms of predictions of future surges, I would assume so, but we'll see. I'm kind of beyond that point. I've been beyond that point for a long time. Keep in mind that, as humans, our time frame tends to be, most of us on average live to be in our 70s, with the longest person, if you live in to 100 or so, that's pretty much the extent of it. So we think in terms of days, week, months, years, maybe decades. but these kind of viruses that work, viruses, bacteria, they don't think in terms of decades. They tend to think in terms of hundreds, thousands, millions of years. So the process will go on and it will work its way through. But until then, we just need to be smart about things. And being smart, from my perspective, means to get fully vaccinated. If you're at high risk and you get sick, make sure that you get on some of that Paxlovid if you're a candidate for that. That's the oral medication. If you're not a candidate for the Paxlovid and you're high risk, try to get some of that monoclonal antibodies, the IV treatments that we're still giving. And yeah, and otherwise go about your business, live your life and enjoy life. And yeah, that's what I would recommend. So that's enough of that for this week. What I want to do now though is, what do I have next, Matt? Oh, I know, a shout out. I like doing shout outs. Sherry Blair, congratulations to Sherry. Sherry is our Employee of the Month here at CGH for August. So congratulations to Sherry. And Sherry, known Sherry for a long time. She does a great job here at the hospital taking care of patients and financial issues that patients have. Okay, so before we go on our field trip, I wanted to just mention that our next Facebook Live is going to be August 18th, and it's going to be with our rheumatologist here at CGH, Dr. Buddharaju. And we're going to talk about rheumatological issues. So be here for that. By the way, that's going to be through our CGH Health Foundation Growing Healthy series for August 18th. Okay, so let me set up this field trip. So within the past 6 months or so, we've been in the process on the third floor of the main clinic of putting together a new oncology hematology space. Kind of outgrown our old space, even though our old space isn't that old. So what we did was, and that I think they start that new space next week. So what I did was last week went through that space the day that we were having a community-wide open house. I kind of did it a little bit a few hours before the open house with our manager, Cindy Wadsworth of the Oncology Department. So I think it's just a chance just to see what we have in place for our patients. And obviously, no one wants to get cancer, but the reality of life is that, a certain percentage of us will get that during our lifetime. And the take home from this field trip that I hope you get is, first of all, if you need to be taken care of, we have a great space to do that here at CGH. I'm going to add to that not only that, but we have a great team of individuals that really do a great job of taking care of our cancer patients here at CGH. And we also have great physicians, and Dr. Ali Khan, Dr. Al Saeed, and our nurse practitioner, Lindsay, who do a great job of taking care of those patients as well. So I feel really good about what we're able to offer folks here at CGH. But without further ado, I am going to sign out for the field trip, and you're going to see the field trip that we did in our new oncology space. See you on the 18th as well. Take time to watch this field trip. Thanks. Good afternoon and welcome to Facebook Live. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. Thanks for joining us for this field trip. And I have with me here Cindy Wadsworth. Hi, Cindy.
Hi.
And Cindy is the director of our Hematology Oncology Department. Cindy's going to give us a tour of the new space.
I am.
Okay, so she's going to be our guide, and we're going to kind of go through the brand new space, which, by the way, as we're doing this video, the open house is actually a few hours from now. So you're getting this preview before the preview. So how about that for you? So that's the plan. We're going to go through and take a look at the space. Cindy, you ready?
I am ready.
Oh, and by the way, as we walk through here, tell us a little about the artwork that we're going to see here and there.
Yeah, the artwork we chose specifically images that would remind the patients of home, rivers and trees and cornfields, things that would help them feel more comfortable.
So basically, like you're not in an office.
Right.
You're
Right.
out
Yeah.
in nature, kind of that kind of
Yes.
calming effect that those type of things
Yep,
can have.
yep, just to give them something to kind of be relaxing and maybe to get them to think about some pleasant things while they're here.
Sure. So I guess the first thing to look at, Cindy, would just kind of
Sure.
the waiting area. So let's come this
Yep.
way with us, if you would. Yeah, very nice and light. Anything to point out, highlight with this, Cindy?
We just wanted to give the patients somewhere to relax where they can watch TV, and we have a couple nice pictures in here as well, and we wanted to keep the vision open so reception would have easy access to see when the patients arrived or if they'd been waiting for a while, so that we can make sure that everybody gets taken care of efficiently and has a nice place to wait when they need to wait a little bit.
Yeah, and actually what we'll do while Cindy and I are standing here, we're gonna disappear for a minute, and we're gonna kind of give you a little panoramic and kind of show you so you can see. This is a lobby and then the reception area in front of us here. So yeah, that kind of gives you a sense of the space that we're talking about. Thanks, Liz. And so Cindy, just the way it's laid out, if you told me right, there's two entrances and one is for tell a little bit more about that.
So you'll see when we go into the department, but basically the department is set up so the clinic side is to the right, and then the patients, prior to seeing the provider, will enter that side and the MA will take them to their exam room. Where our infusion area is to the left, so if they're here strictly for infusion or an injection or a port draw, they'll enter through the left door and then the nurse will take them back for that. And of course we have patients who have the visits where they see the provider and then they go to infusion, and so they'll just move from the clinic side to the infusion side in the back. And we can kind of show you that when we go into the department.
Yeah, good. That's kind of a nice flow there to have that in place. So good. Well, this is kind of the lobby area. What we're going to do next is we're going to take you back and to see the inner workings of the department. Are you ready, Cindy?
I'm ready.
Okay, let's do it. So we're about ready to enter here in the space, oncology space, where things will happen for patients. By the way, just so you guys know, so Cindy and I go way back. Cindy, I think it was this week, 25 years ago, that I started practicing in Morrison. And I think, a couple years after I started practicing, Cindy came aboard and was a nurse practitioner with me for
17 years.
Not that she's counting, she loved every day, but she was just saying it was 17 years. So
17 very short years.
Okay, so anyhow, that's Cindy and I know go way back, and she's done a great job here in the oncology department. So Cindy, let's have you show us the way.
Okay, so the patients will come back, and this is the MA station. So this is where the MAs are located, and they'll keep all of their paperwork here. And then they'll weigh the patients, which we don't have the scales in yet, but they'll weigh the patients over here in the corner and measure them, and then we'll take them to the patient room, whichever one that they're going to, and we could show them one of the
which
exam
direction
rooms.
should we go, Cindy?
Let's go this way.
Okay. Follow us, please. Okay.
So this would just be an example of one of our
I'll let you
exam
go
rooms.
in there, Liz, and kind of show folks. We were talking, Cindy, the exam rooms on the left where Liz is looking, they'll have computers and stuff like that, right?
Right, yep.
Okay. But for now, at least, that gives you a sense of, so nice, roomy exam rooms, spacious, if you will.
And actually right now we have 6 exam rooms downstairs.
Okay.
So we have grown in our volume by adding our new Dr. Al Sayed. So now we will have 9 exam rooms.
Okay. Yeah, that helps. That would help quite a bit, I would think.
Yeah, for sure.
Yeah. Okay, great.
Okay, so this area is where we have our phone nurse office over here. And she basically is the person that's manning the phone. So when the patients call in and they have concerns or questions, she takes care of that throughout the day. And then when the providers need something from the nurse for one of the provider visits, then they will go to her. And then right next to that is the office for the nurse navigator, Sue Hageman. One thing that's kind of neat, if maybe I could show you, is in the offices, we wanted good communication, right? Because we're always talking. There's always a conversation between the nurse navigator, reception. So if you want to step in here real quick and kind of show, we have windows in between so that they can continually communicate. And if they need a little bit of privacy, we can.
What's that over there, Cindy, where Liz has her camera now? That's the reception.
That's reception.
Okay.
Yep.
Yeah, just so folks get a sense of that.
And we're like, Sue is always communicating with reception because she is the intake coordinator. So she's really managing the schedule as well. So they talk back and forth all the time. So that makes that
really nice.
very convenient for them.
And some nice privacy here with these doors too. So I like that. That's great. So what's next? What do you want to show us?
So a little bit further down this hallway, we have an entrance to reception, kind of a back entrance for them. And then we also have 2 draw rooms. These 2 rooms are the drawing rooms. And this is where we will do port draws for the patients if they need labs drawn and port flushes. And then we'll also do our injections in these 2 rooms. And they're very similar to what you would see in the lab.
So Cindy, where are we at now? What are these rooms?
These are our 2 infusion rooms. Downstairs right now we have 1 private room, and we typically put patients in that room that require a little bit extra care. So moving upstairs, we added another one. Now we have 2, and I'll open them up for you so you can see we have a hospital bed in here, and there's just a little bit more room and obviously privacy for those patients that need that.
So what kind of patients would you have would need this kind of room, Cindy?
Sometimes people are just in a little bit more pain and they just need some privacy. If people are wheelchair bound where they really can't transfer on their own, or they need a Hoyer lift, for example, to transfer, then we usually will keep them in a bed. So we can just easily bring the Hoyer lift in here and transfer the patient into the bed.
Yeah.
So it's just those people that need either privacy for whatever reason, or if there's more mobility issues.
Good.
And sometimes we have people that do require a caregiver, for example, to stay with them. So this would be an opportunity to accommodate those patients.
Yeah, nice. Okay, so we've seen a couple of private infusion rooms. What's next, Cindy?
Back here we have the nurses station. All the nurses that are chemo certified that will be administrating the chemo will sit back here.
Okay.
And then we'll have the nurses that are responsible for this side of the infusion center sitting here, and then I'll show you the other side.
So let's come with us, Liz, if you would, and we'll take a look around here. I'll let Cindy kind of do this tour, and I can stand back a little bit.
So alongside the wall are the infusion bays. We don't right now have the chairs in there, but there'll be an infusion chair in here, and then the TVs for the patients to watch TV.
And then we can walk down here and see a lot of nice light there.
Mm-hmm. Yep, so we did add a couple windows because we wanted to make sure that it was light and just a positive environment for the patients. Right now downstairs we have 6 infusion bays. So up here we've expanded to 11, and then we'll just show you walking around. Each infusion bay is basically the same. And then in the corner we just have kind of a larger area, which will be 2 infusion chairs together.
Nice.
With a separation in the middle.
So then, and then you basically have you have 2 wings, really.
Mm-hmm.
Okay.
Yep.
And then this is right here is the
nurses station is here, so you get a little bit different angle. And this was one thing Dr. Ali Khan really wanted, was to have the arched design for the nurses stations and then have the infusion chairs surrounding them in the circular fashion, just because it's really good visibility. Everybody can see the patients very well, and it keeps everybody with that patient view access.
Good.
So I think it turned out really nicely.
Yeah, yeah. Okay, well, hey, let's go down kind of the back hallway here. Okay, so we're about ready to leave about done with our field trip. So everybody, thanks for taking the time to be part of this. And what's this, Cindy?
These are lockers for the staff.
Okay.
They're very excited about it. We have lockers now.
I see names
shorter.
on here already.
Yes.
People have put their names up.
Yep.
Okay,
Yep.
well, I think I should do the same.
You do.
Can I have a locker up here in the oncology space?
Sure, why
okay.
not? Why not?
All right, I'm gonna
big
put they won't care, they probably won't care if I do this, so I'm gonna put it right here. And they're gonna go, who is Bill? right here, Bill. All right. So I've got myself a locker now, so thanks. I'm glad I did this field trip to be able to have that.
Yeah, isn't that nice? This is
That's
the
so
perks.
nice.
It's one of the perks for
Yeah,
being the Facebook Live guy.
that is, boy, talk about quite a deal. I'll have to walk like about 200 yards to get to my locker now, but oh well. Everybody, thank you so much for taking the time to watch this field trip. I hope it was helpful and informative in terms of what the space, and we're really proud of the space that we have up here to take care of patients who have cancer and or other blood kind of issues, and so it's great to have this space now. Please post this and share this and like this and all the stuff that you do with this kind of thing so that folks get a chance to see what's going on here at CGH with oncology. Anything else you wanted to add, Cindy?
I don't think so.
Okay, I just would just say this, that, and I've said this many times, but our team that takes care of patients that has cancer, it's phenomenal. Cindy does a marvelous job. All the doctors, Lindsay, who's our nurse practitioner, all the nurses, receptionists, just it is I couldn't be prouder of the work that we do here in oncology here at CGH. And you never want to have cancer, but if you do, I just feel so good about the fact that folks can come here and get outstanding care if they have some type of cancer and need that taken care of. So
I would just echo that too, how you said we hope that no one has to go through that experience, but if you do, we're here for you, and we will do our very best to take such good care of you.
thanks, Cindy.
Thank you. Thank you.